magical to me, and so I look myself as being a neonatologist in the future.
Okay. Okay. Um, so you told me you like cooking, right?
Yes.
Do you want to speak more on that?
Yes, of course. So I'm from Hyderabad, and Hyderabad is known for food and its Deccan cuisine. And we have the biryani, the chicken biryani, the mutton biryani. And initially, it was kind of disastrous, the things I used to do. But nowadays, I'm excelling. I can throw parties for 20 to 25 people and cook good main course. We have biryani, we have halim. It's like the grinded wheat with some chicken or mutton.
Mm-hmm.
And then I have chicken 65 and the most favorite butter chicken in America. Yeah, I think so. I excel in all those things right now.
Oh, great. Yeah, being a Hyderabadi myself, I know like
Oh, wow.
yeah, what all you're talking about, and I those are my favorite dishes as well. Yeah. So, okay, so what are you looking for in a residency program?
So what I basically think, what a residency program should consist of is a comprehensive approach towards each resident, and I believe that this is what your program is all about, and your program is so strong. So a comprehensive approach that will make my foundation more strong and make me more competent enough to apply in neonatology and to excel as a pediatrician, as a neonatologist, as well as a pediatrician.
Okay, okay, got it. Um, so do you have any questions for me?
Yes, of course. I have a question for you. What exactly do you think are the good qualities in a resident?
Okay, XYZ ABC. Yeah. Okay.
I don't know. See, what I'm going to do is that the name of the faculties, I'm going to read some of their publications, which I've not done yet. And this, I guess, this is the one question
No,
I'm
no,
going
this
to
is a good question as well. You can definitely ask this. Yeah. And you're going to read up on this? Sorry, go on. I'm sorry. Yep.
Yeah, I'm going to read one of the. I'm going to ask like two questions. One is going to be this. This one is like going to be the patent question, and the second one is going to be regarding one of their public medication. I mean, like the publications or something.
Got it. Okay. So I think I've asked you like few questions, 6 or 7 questions, right?
What
You
do you
so
think?
I'll go ahead with the feedback, and then others can add to it as well. So I really liked your tell me about yourself, and I have no additions that I would want to make to this.
Mm.
And I'm applying for internal medicine. So I don't know if in pediatrics you're allowed to talk about your specialty, but for us, the general advice is that we should not specify a specialty unless we have a lot of experience within it, and if you can substantiate with your own examples rather than talking about a mentor who's a 28 weeker, is what I would say. Again, this is something that we have been told as internal medicine applicants. Mhm.
Again, I'm sorry, I didn't follow.
Yeah.
Again.
Okay, so the we are applying. So whoever is applying for internal medicine, we have been told time and again that we cannot go up and say I want this particular specialty. Like we have to play it very safe and say, I don't mind being a primary care physician or a hospitalist or a subspecialty or doing a subspecialization, and we can only say we want to pursue a particular fellowship if we have like months of research in it or months or years of experience in it, like if we have a home country residency. So unless we have such experience, we cannot go ahead and say I want this particular subspecialty. So I don't know how it works for pediatrics. And when you were talking about a 28 weeker, did you say you are a 28 weeker or your pediatrics
No,
meant?
my attending was a 28
Yeah.
weeker.
So I would say if you have at least like, if you were the one who was a 28 weeker, it would make more, it would just make the answer.
Oh,
Not saying it's wrong in any way, but at least that's the advice we as internal internal.
Okay. Okay. Makes sense. Makes sense.
Yeah. Other than that, I loved your answer for, what would you like to change about your past. That's very similar to mine. So yeah, and and I think it was kind of sudden also to you. So I really liked it.
What do you think? Like, do I like fumble or something? And how am I confident enough? Like when I speak, sometimes, when I put in sentences, I jumble up the words. Like I don't know, I do that. It's some kind of anxiety,
Yeah,
I guess.
yeah, I completely understand. I think that's normal, but you haven't made such any like significant mistakes that kind of stood out for me to point out at. Overall, you seemed very confident, but again, I'm not seeing your expressions. I'm not seeing your facial. I mean, I'm not,
Yeah.
so I don't know all of much about that. But how you sound, it is super fine. Yeah, but when there were some questions like, wait, so I really liked your pediatrics answer also. I was thinking first you would only talk about the connection with children without substantiating it, but then again you spoke about how your mom and the orphans and all of
Yes,
that.
yes.
So that makes sense. And when you were trying to state reasons for why any particular specialty, try to have at least three. So here you spoke about connections, connection with the children, and you also spoke about how you saw your mentors and that inspired you. And try to have another reason is what I would say. And you don't have to give examples for all three. Giving an example for one or two is also enough. Just have a third reason also in mind is what I would say.
Okay.
Yeah, they
Okay.
get a
Okay.
good.
I'm just
They
like,
get,
I'm scared
Mhm.
of like, increasing the time span of my answers. Like, I feel like they go so lengthy and it's kind of boring for the faculty. So I try to
Of
like
course.
concise it, and I don't know what am I doing.
So no, concising is good. That's what even I'm asking you to do. But if you want to substantiate, just substantiate the orphans one, and don't substantiate the mentors one, and just say how your mentors really inspired you in medical school, and just how they would talk to the parents of the kids. Kind of inspired you. That's it. And then have a third reason as well. Or this was good. I'm just talking about the
Yeah,
most
yeah, yeah. I
minor.
understand. Thank you so much. Thank you so much for the feedback.
Yeah. And again, you spoke about comprehensive approach from a program. That is good. I like the part about competent physician and, compassionate, competent physician. And somebody again in neonatology who would help me with neonatology. I'm not sure, like if you can talk about subspecialty, but yeah, that's a call you have to make as a pediatric residency applicant. And do you have any questions for me? Yeah, those also work well. It was
Any more feedbacks? If anyone would like to give me more feedbacks. Uh, anyone. I'm ready.
I'm not sure if a lot of them are applying to pediatrics. So,
Yeah, anything, any feedback, whatever, because even anything, I'm ready to, even if you're not applying to pediatrics, I just want
right.
to know what I'm doing.
I'm sorry that I joined the meeting a little late, so I wasn't able to listen to all your answers. But like maybe next time when you say I can
Yeah.
give some feedback. Yeah.
Okay. I guess that's the case for most of them.
Oh, and Dr. Sharif, you can also talk about when you're talking about cooking. So I felt like you were talking mostly about the dishes, and not more. You probably can add a story around it if you want. You did, right? Like you told the Hyderabad part, and so I was thinking you were just mentioning the dish's name rather than what you were doing. At least that's the idea I got because, like, depending on how I was listening, you understood my point.
Yeah. So what do you think? I should like only talk about one dish and then put a story around it rather than talking about all the
No.
dishes.
So do you actually have a story like where you learned it from your from your mom or your grandmom or your relative or something like that, and
Um,
then
okay.
no,
I
no, it was
actually learned it like on my own. Like
own.
initially as I said, it was like bad, and then I kept doing good, and now I really good, and I can even host parties. I do host
Oh,
parties for
yeah.
my husband's friends and all of that. I can say that.
Talk about that. That gives a very personal touch, and that would make them think, even as a resident, you would be able to host these parties, and you can all hang out as colleagues or whatever. So, add
Yeah.
things and mention few dishes and talk about how in yeah, I think it was good overall. It's just that you can add a more
Yeah,
personal
I
touch.
don't have to talk of all the dishes. I can just like pick one or two and then just revolve like make sto like
Yeah,
talk
maybe
about
talk
some
about
stories.
biryani and halim, and just talk about those and how you. Yeah.
Yeah.
Yeah, and chicken
Yeah.
65. Yeah, you can't choose. Everything is so good. Okay. Anyway.
Yeah, I guess the Americans are more fond of butter chicken, so I think I can talk
Ah,
about
yeah,
that.
chicken, correct. And yeah, that's it.
Okay. So, do you want me to like ask you questions?
We don't mind going unless somebody else wants to go for a mock.
I think so everyone is like muted up right now. So.
Okay, fine. I can go and
Mhm.
also see video.
Oh yeah, that's perfect. Hello. How are you
Doc,
doing today?
I'm doing good. Thank you for asking. How are you, Dr. Sharif?
I'm great. So let's begin the interview. Tell me something about yourself.
Sure. So my name is Srijani Tanir, and you can call me Shrija. I was born and raised in India. I also went to medical school in India. So I knew very early on that I wanted to be a doctor. It was something that came very naturally to me as I grew up watching my parents give back to people from underprivileged backgrounds and just give back to the community. So I knew I wanted to follow in their footsteps and do humanitarian work. And as somebody who's always loved learning, for me, being a doctor was the easiest choice. And so I went to medical school, graduated in the top 10% of my class, I came to the following which I came to the US and have gained several months of US clinical experiences and a couple of research experiences as well. Currently, I'm enrolled as a cardiology research fellow at UAB, and I describe myself as somebody um, who's very introspective, as I like to reflect on my experiences and learn from my mistakes. And I would also say I tend to keep a positive outlook in while dealing with difficult situations, as it's always been these challenges that have taught me a lot about myself and helped me become the person that I am today. And outside of medicine, I really enjoy reading books, mostly nonfiction. And I've also been learning pottery for 2 years now. And yeah, I can watch the office reruns all day. And yeah, I'm here today looking for a PGY1 position in internal medicine. It's been a passion of mine since the third year of my medical school. That's a little
Hmm,
about.
that's interesting. So, what do you think your weaknesses are?
So I guess one of my weaknesses would be I tend to overthink a lot, especially about situations that have happened in the past, or just some interactions where I felt like the other person was being a little rude to me. And I've also come to realize how that can be a very unproductive habit, and it can also waste my time. Uh, yeah, so the way I'm trying to cope with it or overcome it is by journaling and meditation. These are the two things I do on a daily basis. I feel meditation really helps me acknowledge my thoughts without letting them take over me. And journaling also really helps me process my thoughts and gain more clarity. And just getting to know myself better, and just getting to know myself better and being more self-aware helps me not take others' opinions too seriously. Yeah. So.
Okay. So you spoke about meditation. What else do you do like for meditation? What do you do for meditation?
Okay, so I use these. I initially when I started, I would use these guided meditations on different on like YouTube, and there's this Headspace app. But right now, I can mostly sit by myself and practice silent meditation. And even sometimes when I go on long nature walks, I have these contemplative walks, and you can just practice mindfulness when you're doing the most routine and most basic of tasks, and just yeah. So I think these are the ways I'm trying to practice mindfulness and meditation.
Okay. What do you think, which was the most challenging decision of your life?
Mm, which was the most challenging decision of my life? Okay, so uh, yeah, so during my journey towards residency, I've had to face numerous family health challenges. It began when my mom had a CSVT stroke, and then my dad was diagnosed with stage 3 Hodgkin's, and I also lost my grandmom, who I was very close to ALS. So while I was I had the responsibility of being their primary taker during this time, I also had to juggle other things like studying for my exams, completing my clinical rotations, as well as my mandatory 1 year internship. So there was just a lot on my plate, and the fact that all of these priorities were of equal importance to me and I had to cater to each one of them, as there was no way I could give up on anything. I just felt like, though it was this phase initially, though it was challenging to make time for each responsibility of mine, I learned a lot of things from here, and I learned how to be more perseverant. I also learned how to let go of the need to control, um, and it taught me flexibility, I would say. And it also helped me hone my time management skills, as like I said, there were a lot of things that I had to tend to. And yeah, so I think this just having all these things to juggle at the same time was challenging for me.
Okay. How will your friends describe you?
Okay, so let me think about this. um they would say I'm very trustworthy, and they would say I'm fun to hang out with, and um I would also think they would say I'm very disciplined and hardworking.
Why would they say you're trustworthy?
Because they think that they can come up to me with anything, like the smallest of issues and the biggest of their problems, and I will make them feel heard and valued. And I would they and not only that, like if they confide in me about some personal issues, they believe that I wouldn't like go and talk about it anywhere else and to anybody. And yeah, and I'm also somebody who's very non-judgmental. I like to not see things or situations or people as black and white, but I'm somebody who likes to sit with the gray of the situations or the gray of the people. So I think they find it very easy to trust me and share their problems or their issues with me.
Okay, that's interesting.
Mhm.
So, yeah, where do you see yourself in the next 10 years?
Okay, so first, in the next 10 years, right? So, okay, as of today, I'm undecided about what I'm going to do after my residency, if it's going to be a subspecial a fellowship, or if I'm just going to be a hospital. If I'm going to be a hospitalist, not just if I'm going to be a hospitalist, that's something undecided for now, and I would want to explore my options during residency. But I definitely see myself being involved in teaching, as it's something that I have been doing since my medical school years. And I also see myself being a part of community outreach programs, as again, because volunteering has been a big part of my life. And yeah, I also see myself being happily married with kids and probably a poodle. So yeah.
Okay. Do you have any questions for me?
Yeah, sure. So I've seen how you've been a resident in this program, and you also went on to work as an attending here, and now you're a program director. So I really wanted to know what made you stay back at the program and what attracts you to this program. You can just say XYZ, yeah. And I have one other question for you. What does the mentorship program in your program look like? Yeah, that's it.
Yeah. Uh, okay, so feedback time. So, yeah, it was pretty good. One thing I would like to say is that when I ask you a question, I don't want you to repeat the question. I
Oh
mean,
my
like,
God, I get this
I
all
want
the
you
time.
to like think about it in your mind. Like, if I
Oh
ask you what are the challenges, okay, so the challenges. So I don't want you to like repeat the question. I guess you
yeah,
understand what I'm trying to say.
God,
Yeah.
yeah, I got
So
this. Yeah.
I think so. These are like the initial stages, and over time you are going to overcome that for sure. Um, the other thing I want to say was about the challenging decision. I asked you what was the most challenging decision you
I
made in your life, and you spoke about like what were the all the challenges you got in your life. But that was a bit, I think so, like not up to the question.
I I know.
Um,
Yeah, I
yeah,
just have a challenging decision that I've had to make, because even if there were challenging decisions, they were all something that seemed easy to me, because like I don't know how this will sound, but I generally like to. I mean, it's easy for me to make challenging decisions. So I just spoke. Yeah, but I get it. Like maybe I should
You
talk
could
about.
you can just say like something like if you moved to United States, leaving your family behind and coming here or something like that. If there's some situation, but you spoke about all the difficult times, but then you spoke about all the challenges, but you didn't speak about the challenging decision. I don't know whether I'm right or wrong, but this is
No, no,
what I
you're
felt.
you're absolutely right, and I knew that I was blabbering for that specific question. I knew the answer as well, but like I said, like I can talk about moving to the US and pursuing this residency journey, but I don't want to give them an impression that this is challenging for me and I'm leaving my family behind, and I will not. I will not be able to cope with that. And the second thing, I didn't want to talk about a challenging decision of taking this USMLE journey is because that's something I enjoy doing. Like I enjoy taking on challenges. So maybe okay, it
Yeah.
doesn't. I think
I
even if
I
it's a
think so you're right. You might be
huh?
right about it. I think so you're right about it. I mean, like moving to United States, you don't want to say that. Yeah, it's challenging because you enjoy doing that. I don't know if anyone else can give some feedback on that or something.
Yeah, maybe challenging doesn't have to be non-enjoyable, right? Like it can be challenging
Yeah,
and also
yeah,
exciting.
exactly. I don't
Yeah,
know.
then I'll have
One
my
more thing, I want to talk about your light. I mean, like, is this the place you're going to sit on your interview day? No.
no,
Okay.
no.
So that's
I
like, yeah.
my virtual interviews I'll pay later, and right now I just have an in-person, so I'm worried about that now. Yeah, this is
Okay,
not.
perfect. Yeah, rest all everything was good. Just a bit of you know, when you say just and then you say no, no, I don't want to say just. I don't want you to do that on the real.
Real interview I
Yeah,
shouldn't do.
you're just like talking to yourself also, and then yeah, a bit of that. I
No,
think.
but that's because I know this is like yeah, I should take it more seriously. But yeah,
Yeah, that was what I felt.
yeah.
I want you to like a bit like stop talking to yourself a lot during the interview, and like even if you want to talk to yourself, you can talk, but you can like stop for a minute and think about it in your mind, and rather than saying no, 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 I don't want to say this, no, no, I want to say, don't do that. Yeah, that's what
That's
I think. Yeah,
yeah.
restaurant, you were good. You were doing super good. That's it. I think so. Your words were really good. I really liked the words, the catering and all of those words you used, and I really liked all of that. And yeah,
This was very helpful. Yeah, Amina, very helpful. Yeah, thank you.
you're welcome. You're welcome.
Does anybody else who's heard me have any more feedbacks, guys? I really want to learn.
Yeah, I think you did well overall. But you were gesticulating a lot, using hand movements, a lot of that. Then, what I also noticed when she asked you about your goal, assuming, let's say, assuming it's a community program, I don't think there's any need to mention fellowship if the program does not offer fellowship and all that. So
Got
because they're thinking that, oh, we can't help this person and all that. So maybe you just focus
oh,
on being a good, maybe internist or primary care physician.
okay,
Then
sure.
I don't know if it would be appropriate for community program to say I want to keep my option open as in right now, because we know that their aim is for them to make us be a good or maybe a well seasoned PCP or maybe an internist or something. So that's what.
Yeah.
But apart from that, I really like your examples. I like everything. You were confident when you were answering the question, despite the fact that you didn't really prepare for it, but you were able to give good answers to them.
Thank you so much, Dr. Salahuddin. I also wanted to know, did you say I was using a lot of my hand movements? Is that what you said?
Yes, hand movements,
Oh,
shaking your head and things like that. I don't know if that's appropriate.
yeah.
So yeah, maybe
Maybe
you can just
it's
reduce.
it's excessive, I guess. Okay. I'll keep that in mind as well.
Yeah,
Thank you. Thank you so
yeah, you.
much.
I only have one feedback.
Yeah, sure. Sure.
Just just if you can speak a little slowly, I think the rest everything was really well, and all the answers are very apt and perfect. Just a little slow when you speak. That's it.
For Thank you. Thank you, Simi. Yeah. Mhm.
I was also going to say same only. It went little fast.
Okay. Yeah, I get this also often, and the repeating questions, I don't know why I do that. Okay, thank you.
Yeah, hello. I would like to discuss this question about if you made a difficult decision sometime and you would have done things differently if the things were different, something like that. So it's about a difficult decision you made. If anybody has inputs or insight about that, I would appreciate it.
Alisa, do you want to answer?
I really haven't thought about this answer. You can go first, and then I can add one.
Okay. So I guess I would say something like, you know, how every decision that I took, or every difficult decision, or every mistake that I made, it has made me into the person that I am today, and it helped me grow into the person that I am today. So looking back, I wouldn't change anything about it, as all of these have led to me being, you know, this person today. Again, I wouldn't, not to just sound diplomatic, I really think that's my honest answer.
Yeah. So what you are answering is like, okay, there was something that you did, and then going back if you would like to change it. But
Okay.
the question is like you have to describe some time when you made a difficult decision. Like I know that on YouTube, I've heard people say that, okay, there were two patients and there was one ventilator, and then they had to decide like which one to something like that. There was one person was terminally ill and he was not going to make it, so they had to use for during COVID times there were several times when people had to do things like that. So they actually want an example of a time when you had to do something that was not that you wanted to do, but you had to do it.
Got it. It can be personal,
I,
it doesn't have to be just clinical, right?
I'm
I
not
would.
sure. I'm not sure about that. Say personal. Like everybody will have some things in life that they don't want be difficult, but nobody says personal stuff in a interview like this.
So
Usually,
this would be my question too. If they mean something personal or something during your work, like professional
yeah,
wise, I'm not sure. So if
hmm,
if I if I ask if I have to I mean if somebody asks me this question, I will ask them, would you like me to tell you about a difficult decision like career wise or my personal life? So
yeah,
because because I need an I need you to direct me with
specify.
what do you want me to discuss?
Yeah,
Yeah.
yeah. I don't think they will means they will like to discuss personal life much in this kind of interview. Uh, people here are very private and they usually don't want to go into your private life also. So usually it is you have to describe something that happened when you were working in a hospital or with patients, something like that. I don't know if they'll ask the question, but that is one of the questions that we are supposed to prepare for.
Question to this question. I mean, can we add example of any challenging situation and answer this question?
Yeah, I'm sure. Yeah, challenging situation. It is a challenging or difficult situation, and you had to take a decision which was not like the best. You had to choose between two things, and it was not the ideal thing that you would have done otherwise, but you had to do it under the circumstances, something like that. So I'm not sure. Means I've heard one person say that, okay, there was one patient in ICU and he was terminally ill. He had cancer. He was not going to make it, and the other person also was sick, and they both needed a ventilator. They had only one ventilator, and he gave it to the person who was going to make it, and really disappointed with the decision, but under the circumstances, it was a difficult decision that he made, and yeah, so
I can
I'm not.
speak for myself when I say that I didn't have such big responsibilities. Like, I don't have enough experience to have had such responsibilities where I had to make patient decisions. So I would probably stick with a more personal one, in at least
Mm,
in my.
mm,
Mm.
yeah, yeah, yeah. I guess we can be judged. Uh,
Yeah, but if they ask us, can you tell me about a difficult decision? Only then we can say anything, either personal or professional. But if they specifically ask us, can you tell me something about a situation when you have a difficult decision in your medical career, then we need to focus it on medical part.
yeah, yeah. Like, if you guys have any examples or anything comes up in your minds, then you can
Okay,
share
so
that.
yeah, sure. So I have one. There was this ethical dilemma question, and you can approach the question something like this, like where you talk about a patient who wanted to try alternative medication, like herbal remedies, for
Okay.
her cancer treatment instead of the conventional treatment, which is chemotherapy, surgery, or radiotherapy. So how you had to convince her, but there's also this whole patient autonomy, so you were posed with an ethical challenge where you had to protect the patient's autonomy, but you also had to give her all the information regarding her treatment for the evidence based treatment. So I think something like this, where you had to let go and let the patient make her own decision and be supportive of her throughout her journey. Something along those lines is something I would say, and I just thought about it now. Yeah, I mean,
Yeah,
I had the answer for ethical dilemma, but I just thought this could work here as well.
yeah. This will definitely work, and it's a good answer, because this way we don't put the patient in some kind of harm. It is a safe situation for the patient, so they will probably not judge us for doing anything that is very strange. And yeah, yeah, herbal medicine is sounds
Okay.
Hello. I
good.
just remember something with this good example. Is it we can use the example for the patient, for example, for his like uh, like religious belief or something. He refused the blood transfusion, but also the patient dying because he's bleeding heavily, and I just involved to just
Yeah, that is also a good example,
promote
because
something.
that's again ethical stuff that they are acceptable. They accept it here.
Yeah.
And sometimes when people also get into like accidents and they need multiple surgeries, but they don't have the money to get it done. Like, I've heard somebody speak about this as well, so I don't really remember the answer properly, but yeah, similar
Yeah.
answers where to not we weren't able to do anything because of the ethics that were in
Yeah.
play.
And it can also be something like, okay, so if a person needs some kind of surgery or chemotherapy or whatever, but they do not want to go ahead. So they just want to go home, and they don't want to get treated anymore because it's like end of life kind of situation. They just want to be with their family and die peacefully or whatever. So it was a difficult decision because you were very attached to the patient throughout your the treatment that you gave, uh, but they made their own decision. So that was little hard for you, uh,
But
because you
That's
wanted their best. You
Can
wanted
that's
yeah.
to help the patient.
What about this example of using a patient with diabetic foot ulcer that is already gangrenous, but the person was praying and hoping that the leg would not be amputated because it will affect the person's life generally. But
Yeah.
after carrying out the necessary investigation, you notice that it has gone deeper, and the best thing you can offer the patient at the moment was amputation. You know how difficult it is living your life without maybe a
Yeah.
leg.
Yeah.
Then we made the patient understand that if it's not done, it could spread further, and it could also result into sepsis for the patient.
Mhm.
Took a while before the patient could accept. Then things like that. I don't know if it will
Yeah,
work.
that's another very good example. Very good example.
Oh,
Thank you.
yeah, you're welcome.
Okay, I'd like to add one example. I don't know if it will fit in this or not, but it's more like an ethical dilemma. So, my example is while I was working in a pediatric hospital, I had one case in an emergency department, and it was a preterm newborn. After doing the initial management, the child needed ICU support, but due to the poor financial status of the family, they couldn't afford to keep the child in ICU. And as much as I wanted to help the child, I couldn't help the child. And we did an extensive communication and we consulted everyone, but we couldn't do anything. And then we counseled the family, and we referred the child to the nearby government hospital that was around 5-minute drive from our center. So at that time I felt very helpless, and I wanted to help the child, but I just couldn't due to the poor financial status, and it was really difficult for me. Does this fit in this?
Yeah, that does fit in it, but the thing is, they might not relate with it in America because here they have so much of other organizations that help financially poor people. So they will ask, they will probably ask. So there was nothing that you could do. Like you don't have those, charitable or whatever NGOs or stuff that can help a child. So something like that.
Yeah, but it actually happened in my. But
Yeah, I'm sure it happens all the time in India. It happens all the time. So yeah.
okay, then
You
maybe
can
I'll.
say you can cite this example because if it is a real life example, then you are better able to say it out, and you
But
can
even
answer all their questions. You can say in the end that okay, yeah, initially it was like that, but later I was able to arrange some help through an NGO, and things worked out. But initially, you know, so it was hard for me.
okay, but if I say I could finally manage some support for that patient, will that be difficult situation? I mean, it will be difficult, but will that sound good?
I'm not sure. I like the amputation answer better.
Yeah, I'm really.
Could you
Yes.
please repeat the amputation answers again? Sorry for that.
A patient has to have surgery because of diabetic foot, has to lose the foot, and you've been treating the patient since several years, so you feel connected to the patient, and you feel that how it will be very difficult for him to live a life without a leg. But there's nothing you can do because otherwise the sepsis will spread to his body. So you have to go ahead and amputate the leg to save the life of the patient. So that was very
Yeah,
difficult.
it is very good and actually happen here and in India, in Sudan,
Yeah,
everywhere.
it happens
Yeah,
everywhere, even in America all the time. So
yeah.
I think that's a good one. And then also the Jehovah's Witnesses, like those where they refuse the blood transfusion, that is also very good, acceptable answer here because they know that
I know that.
ethically that is how it is.
I have it in my country, to be honest, also. Like, they are not Jehovah, but they are like a special type of tribe. They don't
Yeah,
believe in the blood transfusion. So, yeah, I think we can put those two. Hmm?
yeah. Thank you.
Okay, let's continue with the mock interview. Um, does anyone want to ask questions? I'll try to give answers.
Okay, sure, I can go if nobody else wants to ask.
Okay.
Hi, Dr. Alisa. How are you doing today?
Hello, Dr. Shriza. I'm doing good. How are you?
I'm doing good. Thank you for asking. Would you want to tell me a little bit about yourself?
Sure. First of all, I would like to thank you for giving me this opportunity to interview with your program. I'm Dr. Elisa Casey, an international medical graduate from Nepal. I completed my medical school from Nepal itself. And after my graduation, I have worked in a few hospitals with multiple pediatricians, which has equipped me with my teamwork and my skills. Currently, I am in US, having family here. I moved here around 4 months back, and I'm doing an extensive with a primary care physician based in Texas. Apart from medicine, I am a very fun-loving person. I love to travel different places. In fact, I have a YouTube channel in which I share my travel stories, food vlogs, and other funny challenges as well. I love doing water activities. I love snorkeling, and I recently did scuba diving. I am also a big time foodie, and I've recently created an Instagram page in which I share my food stories. I'm a very positive person, easy to work with, and have this drive for continuous learning, which I think makes me a very strong candidate for your program. I am really looking forward and excited to start my journey of residency with your program. Thank you.
Okay. So you said you like traveling, right? What are the places that you traveled to recently?
Okay, so I mean, within the span of last year, I've traveled to 5 different countries. I would say I traveled to Bangladesh, I traveled to Singapore, I traveled to Maldives, and I also came to US. And what was the next country? I forgot myself.
Okay. So that's great. Which specialty are you applying for? Is
I'm
it
applying.
pediatrics, right? Okay, because you said yeah. Why pediatrics?
Okay,
Think one.
passion for pediatrics initially started with my personal experience of having my younger brother with ADHD. All those struggles he faced and the challenges we had as a family really made me understand the need of a good doctor, and I want to be that doctor for other families so they don't have to face such situation. And also during my medical school, I was a part of poor patient fund team, and I have supported them financially with cleft lip and cleft palate surgeries. And it was really gratifying to provide them life changing surgeries. And in pediatrics, you get to practice holistic approach from an early stage of life, and not only support their physical needs, but also their emotional and psychological, as a result of which it can shape their future as well. Besides, you also get warm hugs and smiles of little children that really keeps me going.
Okay, that's great. So tell me something about your strengths.
Okay, I would say my strength is adaptability and resilience. Coming from a different country and trying to build a life here was totally a strange and difficult thing for me to do at first. And then regarding my resilience, it is my resilience that has put me in a difficult situation and that has made me come out of it even stronger. For example, during my USMLE step one, I had my wedding, and I was all over the place with the wedding functions, the celebration, and I was so busy, but still I took out some dedicated time and did hard work and studied and finally passed step one. So I would say it's my adaptability and resilience for sure.
Okay. Now, what is one weakness that you have?
Coming to my weakness, I really find it difficult networking and public speaking. Now, it might sound cliche because I said that I love making YouTube videos, but speaking in front of camera and speaking in front of a whole lot of people is a totally different thing. So I usually tend to find myself staying in the background and not voicing out my concerns or not expressing my feeling. But right now, I'm trying to overcome this. I've joined organizations like Lions Club, and now I take part in their monthly meeting and give my opinion as well. I've also tried speaking in front of mirror or keep any of my relatives or family member by my side and just speak and then ask them to give me a review. That has also helped me. It's still a long way to go, but I'm definitely getting better at it.
Okay. Um, okay, so wait, 1 second. What are your short-term goals for residency?
Okay, that's a very interesting question. My short-term goals would be to get myself adapted in the situation, and I would gradually build my skills. And I would like to know how the environment is over there and how the working environment is. I would like to get to know the residents, my seniors, and the attending, and then gradually I'll build it up from there and have a familial environment over there as well.
Okay. Okay. Mm, 1 second. Does anybody have any other questions for Alisa in the meantime? I'm looking for more. Okay. What challenges do you expect to face during residency?
Okay, that is also a very interesting question. As I am from a different country, so I have been exposed to a few extensive, but I believe every organization has a different way of approaching and doing things. So initially, it's going to be a bit difficult for me to understand the healthcare system and how the working environment over there is. So I think that is going to be initially challenging, but with time, I'll get used to it.
Okay. Um, Tell me about your research experience. Do you have research? I'm asking this.
Okay, yes, I do have few research experience, but one I would like to say, which is very close to my heart, is one of febrile seizure, in which my role was writing the manuscript, collecting the data. I also I also helped in reviewing and multiple PowerPoint presentation as well. And we did a research in which we compare whether neutrophil and lymphocyte ratio can help to differentiate types of seizure or not. Since it's a clinical diagnosis, but one can always put extra effort. And so at last, we came to a conclusion that by seeing neutrophil and lymphocyte ratio, we can totally differentiate between types of febrile seizure, which will be helpful clinically as well. That was
Okay. Yeah, that sounds interesting. And how did you hear about our program?
Okay, so I was researching through the programs and then I came across your website. I came to really like your program since it really focuses on didactics and it has the simulation programs and also research experience, which I'm really interested in. It is also one of the largest hospital and a tertiary care center which provides with diverse patients. So I'll get exposure to a good variety of cases and patients as well. And while I was going through the website, I also came across through the videos in which residents were saying that it's a very good place to be. It has a supportive environment. So I like to be in such a place where I can grow my best. Besides, I also really like the location of your program, which is really close to my home. So that's why I'm interested.
Okay. Which one is your favorite USC and why?
Okay. My since I have done few rotation which are in medicine and one was in urgent care. I would say my every externship provided me with different learning opportunities, but my best has to be the one I did in pediatrics since it is my interest and my field of choice, I believe. So yeah.
Okay. Yeah, I guess that's it. If anybody else wants to ask, then ask. Okay. Okay, yeah, go ahead.
I'll ask one. Yeah, tell me about a time when you had to deal with a conflict and how did you handle it?
Okay. So it was a time when I was working as a medical in charge in one of the hospitals in my country, and there was a colleague, and other colleagues of mine were complaining that the colleague is not completing his task on time, and as a result of which they are also facing difficulties. So me being the duty officer in charge, I talked to the person. I did a one-on-one conversation in private and asked what his situation are and tried to understand his perspective and what is the reason he is not completing the task on time. And I came to know that since he was a new joinee in our hospital, he was having problem understanding the system. So I took out some extra time and taught him how the system works and how to make discharge, how to enter the data. So after that, he never did that and completed all his tasks on time, and it reflected good on all of us as well. Hello?
Yeah. So, yeah, if everybody's done with their questions, we can go to the feedback.
Yeah, I guess
I
we have
have
asked
one.
most of the questions.
I'm
Sorry?
sorry.
Yeah, I guess we have covered most of the
Most of
important
the questions.
questions.
Yeah,
So
right,
yeah,
right. Okay, so Alisa, I was really good. I liked all your answers. They were well structured, and you look really confident. But the last question that I asked, what was it about?
I think
Um,
what's your favorite?
Favorite rotation, I would have wanted you to substantiate it more, and I would want you to only talk about your pediatric rotations, and among them, which one of it is your favorite and why. Like you have to state few reasons, like how did it, it could be how it personally touched you also. Like it could be the because of the attending, or it could be the kind of patient population that you saw there, or what kind of cases you saw there, and what you learned from that rotation. It just can't be this was my favorite rotation. So
I'm
yeah.
for that
You were
question. So
doing so well until that point, but yeah, only that. And the weaknesses, yeah. So the weakness, I liked how you answered it, but I also think that you don't have to go and say I am somebody who can't be assertive. I can't you used a line where you said I cannot give my opinion. I know now you're trying to change it, but try to not say that part. Just say public speaking is your issue. Don't say that you can't be assertive, okay? Because that might come across as somebody that can make you come across as someone who probably won't stand up for your own rights or your patients. Again, that's my opinion. It was good overall. It's just that if you omit that one sentence, it could be like even better.
I shall
And
not say.
yeah, your tell me about yourself is also very good, but I don't think here they want to hear so much about how you're interested in the program, how you're interested in the you because in your tell me about yourself, you added in the end like how I would really like to be a part of your program. I think that you can say like when you're ending the entire interview and when you're leaving, but you don't have, again, this is my opinion, people can have different opinions and in the same room right now. Otherwise, it was overall very good, and you had examples for everything. Yeah, you substantiated everything well. I liked your why pediatrics answer as well. You had two different experiences.
Thank
So, yep, that's all from
Yeah.
my side. Yeah.
Yeah, I think you are a great applicant and everybody is going to like you because you are very pleasant and the way you talk, the speed with which you talk, it is neither very fast nor very slow, and you are very spontaneous. Like you are not taking any breaks to think or fumbling with words. So it was all very spontaneous in a great flow. I think you are a great candidate. You can refine your answers, like make them little bit smaller than. I think that would be good.
Okay. So
Yeah.
so I'm not taking time to think. Does that make it look like I've already prepared these answers and I'm just saying those?
No, no, you don't sound mechanical at all. You
Okay.
sound very natural, and that's good. And you don't have to think, and you don't have any problem with your English, which is very important also. So yeah, I think you are doing good.
Okay, thank you. Anyone else who wants to give me feedback, please?
And also,
Um,
short, yeah, somebody else.
Hi, Alicia. Can you hear me?
Yeah, I can hear you.
Okay,
That's
so I really liked your answers, but one question I have is when you said about like tell me about yourself, I thought that you told more about your like hobbies and interests and extracurricular activities. Like I think we have to first tell more about your background and your
Mhm.
accomplishment, like through your medical school, and like interest in your this program, and why do you fit in this program, like some of your qualities, and then it would be good if you say about your hobbies and interests. Though you
Okay.
have good things to say, because in your hobbies and interests you said about your blogging and YouTube channels, but I think that should be like that should be less, more should be these things.
Okay. I'll try doing that. Thank you.
Okay, you're welcome.
Actually, I had applied for most of the pediatrics program and few internal medicine program, and I have my interview in pediatrics next week. But just I think around half an hour back, I got an interview, and that's from internal medicine, and they only have slot open for day after tomorrow. So I don't know what I'm going to do. I'm not prepared anything for medicine.
Yeah, I
I think
think basically it's almost the same thing, but your why pediatrics will just tend to why internal medicine. So maybe you just look or you start thinking around why you want to go for internal medicine. But all the other answers would be almost the same thing. You get what I'm saying? So I think that's the major thing you have to like work on now. Why internal medicine?
I have
And
to.
yes. Yes, because the other things will be the same. Tell me about yourself, a challenging situation, difficult. So they'll be like, it can be applicable to every other specialty except the, tell me about it. So except the why internal medicine.
But in an internal medicine residency, can I give example of pediatrics, or should I give example of medicine?
No, I think internal medicine would be good for you to give an example. Yeah, maybe a case, adult, it won't be a pediatric case again. Like when you were mentioning pediatric case, this should be like maybe an adult, maybe case or scenario. Then maybe if you have experience working at home in maybe any settings, like maybe inpatient or outpatient settings where you see adult population, so you can just mention that your experience in that area would help you and all that. Okay. And some people usually mention in internal medicine, but I think it's like a broad umbrella and it should be advisable, but you can just build your point around it. Like the um, ability to develop long-term relationship with your patient, and maybe the challenging cases or interesting cases in internal medicine would maybe mentally stimulate you to always, as in like think ahead and things like that. Then maybe there are different career options in internal medicine. It's flexible and different career paths you can decide to do. Internist, primary care, or maybe specialize, like you said, then maybe become a clinical educator as well. So you can use any of those points, but use your own personal experience to maybe a scenario for internal medicine, or maybe when you worked
Okay,
at
thank you.
home. Yeah, you're welcome.
Else wants to practice?
Yeah, I mean, if everyone is done, then I can.
Hello.
Hi.
Okay, then I'll ask you a few questions, and then someone else can ask you further questions. Okay, hello, Doctor, how are you doing today?
Yeah, I'm doing good. Little bit nervous, but it's okay. I'll manage it.
Okay, tell me more about yourself.
Yeah, I mean, as you call my name, Sapta, my friends and colleagues like me to call in this name. I born and brought her from eastern part of India, which is in a rural background. And also to specify it, I'm the first USMLE aspirant of my native area. And professionally, I was working as a pediatrician for last 6 years in Delhi, capital of India. If I'll talk from the scratch, then I joined a residential school and college through scholarship. Then I joined the best medical school of my state, again through scholarship, and one of the good residency program in pediatric in Delhi. After 3 years of residency, I have done my senior residency, which is similar to chief residency in USA, by leading my juniors and also working for the pediatric team. Um, then after that, I moved like to USA, my dreamland, for clinical rotations. There, I did approximately 6 months of clinical rotations in two best places. One is MGH and another is UMN. I have learned many newer aspects of medicine also in United States. Beyond my medicine, I feel like I'm kind of a resilient girl who loves to, work with integrity and absolute respect to human values. My sheer inclination is towards leadership, creativity, and public speaking. In free time, I like to read self-help books and also like just inviting my friends for some good dinner. So yeah, that's about me. Currently, I'm actively doing some community outreach projects and also looking forward to settle with my fiancé in the near future. So that's about me.
Okay, that's interesting. Can you tell me one of the difficult decision you had to make in your medical journey?
Okay. Um, Actually, there are few decisions which are definitely challenging and difficult at that particular time. One of them was like doing my residency in pediatric. It was not kind of difficult, but my I mean, national rank was quite good. Even though I had like lot of options to choose different branch, with absolute respect to all other branch, I choose pediatric to stay for lifetime for my own passion and also like kind of a connection with the children and the branch I like. I got immense work satisfaction through my experience in pediatric. So that was kind of a difficult options to choose for me like 6 years back, because when I had like 20 branches, 20 options to choose, but I deliberately took pediatric, and it was not just a mere chance. It was kind of a conscious decision to be in pediatric for lifetime. So yeah, that was one of the difficult situation. It was not difficult, but quite significant decision of my life.
Okay, since you said that you had other options as well, but what made you choose pediatrics? Why
Yeah,
pediatrics?
definitely. First thing is the interest has started from my clerkship period when I did my pediatric clerkship in third year my medical school. During that time only, I got a like instant connection, like love at first sight when I saw the children, because they are curious, innocent, and like very daring to take any kind of challenges. That is something which actually resonates with my own personality. So apart from that emotional connections, I feel pediatric is a branch of enormous opportunity of seeing wide variety of clinical pictures, procedures. Like there is a like huge knowledge which you need to grasp to be a good pediatrician. And also during my particular work experience in pediatric, what is my observation is if you apply your knowledge and skill at the right time, in fact in that golden period, you can this drastically change the prognosis outcome from 0 to 100. So the work satisfaction that I got from pediatric was like quite outstanding. And for example, doing NRP, you can just prevent the severe birth asphyxia by just applying the procedure in that 1 minute golden period. So that way I feel like pediatric is something which was always near to my heart, so I have chosen this branch.
Okay, so since you have past experience of working in a pediatrics hospital as a pediatrician, and some of our residents, they are just first year, it is their first year of getting exposure to pediatrics. So how will you deal with that since you are more experienced than your seniors? So will it be difficult for us to train you, or will you find difficulty being under seniors that are actually less experienced than you?
Okay, doctor, I take this as a very positive thing, because I feel like my 6 year working experience is making me a reliable and dependable, candidate for your program to adopt to any kind of near and also like critical conditions um, in a very short span. So I'm like, however, because I'm very curious and I believe in lifelong learning, so I'm very open to learn any kind of newer aspects of pediatric that will taught to me through the process. And in fact, I'll try my best to contribute to your program, like even helping my colleagues in different ways. And also, like, I'm very acceptable to learn any kind of knowledge from my seniors, from my juniors, and from my colleagues. So that way, I feel like my experience is going to add values to your program in a positive way. Yeah, I'm not at all a very hard learner. I'm as my personality is to connect to people very easily. So I think I'll mix with the team very easily.
Okay, so this was one of the questions which was asked. I heard it in this interview as well. You?
Yes, true.
There was a if there was a fire in your home, what would you do first, and what are the three things you'd like to say first?
Oh, what? Sorry, please repeat again.
If there was a fire breakdown in your home, what would you like to do first, and what are the three things that you would say first?
Oh my God.
Actually, this question was asked. I heard.
I'm feeling I'm inside the flight. So, okay. The first thing is definitely I like to save myself, and then I'll see my surrounding. Like first, I'll save myself, and then my near ones. Second thing is I'll try my best to save my near ones, and uh, third thing is I will I'll try to keep some precious things like. With me, maybe my medical certificates, if it's possible, after saving the human values and the other like living creatures, if it's possible, then I'll try to keep my medical certificates with me. I'm not sure. I'm not prepared for this question. Sorry.
Okay, if you could be any animal, which one would you relate to, and why?
Okay. Okay, then I think I'll go with lion. Because first thing is I have a spiritual connection because eastern part of India mostly worship lion and Lord Durga as a symbol of power and strength. Apart from this spiritual connections, I feel like lion is a leader. He is dependable, predictable, and also courageous to take risks. And also in his what I've read that in his relationship, lion is very fixed and also like very focused with the goals. And these are something which actually resonates with my personality because I believe in leading, organizing any team and contributing that way. So that's why I'll prefer lion.
Okay, okay. Someone else can ask questions.
Oh my God, these behavioral questions are
Yeah.
difficult to answer.
So why our program?
Okay. Definitely, there are many reasons to talk, like why I'm interested for your program. But first thing I want to say, actually, first thing is I'll see their website. That way, I'll tailor my program. So, okay. The first thing I feel like, your program is giving utmost important to the academics, clinical experience, and, encouraging residents in for future champions in medicine to be global leaders. And as my interest uh, resonates in these aspects, so I feel like I'll be a good fit for your programs, and my interest will contribute to your program in a better way. Then I have seen somewhere that your program is doing a lot of work for communities, doing community outreach projects and all. And I have been actively involved in community service and community outreach programs uh, for a long time. So that's why also I'm interested for your program. Another thing I want to talk, if it's a university program, I want to talk about research. Inevitable part of medical learning, so that is also one of my interest areas, so that's why I'm interested for your program.
Since they asked me last year, They said, time you are wrong and the other people are right. And then he asked me, tell me about the time that you are right and the other people are wrong. And two more
Oh my God.
brain questions. Two other more.
Okay, I mean, I can answer in a diplomatic way. That the first question I would like to answer, that was not a very significant incident, but yeah, it's it's an incident during my medical learning when I was like fourth year medical school student. I was seeing a camp. I mean, I was posted in medicine ward, and there was a case which was admitted with chills and fever and all these prodromal features. So as my med school is prevalent for malaria, then I thought the case to be a malaria case in first place. So that's why I started, doing all the lab work for the malaria. But when I talked and discussed with my attending during the morning round, um, at last it was found to be leptospirosis, because that time I have missed the conjunctival examination, which was like I missed seeing ecchymosis and other some findings. So from that particular incidents, what I've learned that taking history, doing complete physical examination is absolutely necessary before doing any kind of provisional diagnosis, and we should think very widely instead of sticking to one to diagnosis. We should think all the possible diagnosis to draw some better conclusions that will be really helpful for patient care as well as as a part of learning. So that was a time where I was wrong and my attending was right. But yeah, that was like as well just a like medical school. So I'm taking it as a positive thing because I've learned from that incident.
Good answer, yes.
And I will talk about the second one, like when I felt I was right and others were. When I was working as a pediatric resident, and my posting was in NICU. During that time, I had a responsibility to take one of the sick cardiac baby, a cardiac newborn, to a nearest referral center for the echocardiography, because during my time our setup doesn't have the echo facility. So uh, on the way, surprisingly, even if everything was checked before, there were on the way, while I was inside the ambulance and the patient family side also there. So some technical error happened and the oxygen cylinder could not work properly, and the baby's saturation started decreasing. And so as a primary responsibility, I called ambulance, alternative ambulance number. I started calling the doctors from the nearby hospital just to shift that sick baby to the nearest hospital for keeping all the vitals stable and everything okay. So initially, my pediatric team thought I have taken some, drastic decisions. But when I returned after everything, after making the sick baby's condition vitally stable with my team, and also at last his echo had been done. So when they listened to me the entire story, then that time they just appreciated for my presence of mind for saving that baby. In fact, so that was a situation when initially people take it in a negative way, but at last they realized that that was the decision which was taken on that point for saving that baby.
I like your smile also, Anil. You're really relaxed.
So I'm not relaxed. Now I'm relaxed, not in the main interview.
No, you will be like this. The interviewers, they know how to make you like, if they are okay or nice. Mostly they try in the beginning just to calm you down, because they know. So be sure it will be even relaxer than here. Yeah.
Any feedback about the second part of the question? That's okay to tell?
Yeah. Yeah. Yes, I think you have to just cut, like try to just lengthy. It's not that lengthy
Yeah.
because you have some details, but try to make it a little bit shorter. Yeah, but
Yeah.
it's good. Both of them are good, to be honest. Especially
Okay.
you're not. I try to remember the other two or at least one. All of them like this, and it was the first time, so.
Okay. Yeah. Okay.
Dr.
Go
Sapta, you
ahead.
have many experience, and as a result of which your story is also so nice. You have so many things to talk to, and the interviewer will be very
You
interested in
all can borrow my story and you all can excel in your interviews. No harm, nothing. But just make sure that you'll be able to answer the follow-up questions also.
Okay, and since you said since you are so much interested in pediatrics and you have this dream of continuing pediatrics throughout your life, but what is one thing you don't like about this field?
Okay. Actually, this field is a very challenging and unique in various aspects because pediatric is not about only taking care of the babies. I just want to modify this question this way that this is not something that I'm not liking, but sometimes I'm going to talk about some aspect which makes pediatric little bit more challenging because when we're dealing with the pediatric, some of the times the babies can be cranky, and some of the times there are a lot of like different presentations. Like for example, simply just very high tone of cry can be a form of seizure. So if you are not very much experienced, then there is high chance that you are going to miss that diagnosis. So for pediatric, you have to be very skilled and knowledge is in first place, and also you have to be very patient to handle the babies as well as their parents and their relatives. So mother and parents and babies go hand in hand. So sometimes you have to do double work, like just to convince everyone. So that is one aspect which actually makes pediatric more challenging. But it's not like I'm not liking it because I have a good communication skill, so I'm enjoying it. But yeah, sometimes it may actually test your patience skill. So that that's why I want to answer this way.
Okay. Can someone else ask other questions if they have?
Hi, Dr. Sapta. I would like to ask you a few questions.
Yeah, sure, go ahead.
Since you have mentioned you have done residency in your home country in pediatrics, right?
Yes.
So I would like to ask, you have done your residency, which makes you a unique candidate. You have more experience compared to others. But what made you decide to leave, to do the residency again in US, doing it in your country? So that is my question.
Okay. First thing I want to start like this. The pursuing, medicine in United States was already there with me since I was in class 6 because I am from a residential school and my founder stays in USA. So I know our curriculum, our everything was like very much very much I'll say uh, um, motivated from the USA curriculum. So pursuing USMLE was always there with me, but uh, because of financial issues and also because of a lack of proper guidance, I could not pursue that journey during my med school, to be honest. But when I did my residency in Delhi, then I got to know about the USMLE journey in a better way. So that's how I started the journey again, because that prior to do USMLE, to do residency in United States, was always there me. And I'm someone who don't easily give up something. So that's why I started. Even if it's late, I started. Another thing is I am very passionate to learn in universities, in in hospitals in USA. I have grown up listening the stories of big universities, hospitals, research of United States, and also their curriculum, their encouragement for leadership, for advocacies. These are something actually I like, and I have been doing throughout my career. So that's why that was another thing which actually motivated me to do my residency in US again, because I feel like I'm always US is the place for me always. um, and the third thing I want to say, like, even if the medicine approach to patient care protocol are moreover similar in United States and India, because we are also following all the reference books like Nelson and Harrison, but still sometimes the way of treating medicine and the prevalence of cases because of geographical difference is little bit different in USA. Like, for example, the teamwork, the way they work, like there is a good collaboration with pharma, insurance companies, social workers, like nurse practitioners, doctors. Like, the physicians are not only responsible in a single-handedly for the patient care. Everyone is responsible. So that aspect also I like about the USA system. So that's why I want to redo my residency again, and I'm a lifelong learner. So I want to learn the newer aspects again and again.
That was a beautiful answer. I really like the spirit, Dr. Sapta. One more question I would like to add is, since you have done your residency, so there it's like I'm considering you are an older graduate.
Yeah.
So do you think your age would be an obstacle for you to excel in residency?
For sure, it's not, because first of all, I have done everything in my first chance. There is no gap. So, and what is my belief? People do some research, people take some time in preparations, and lot of things they do in between before pursuing USMLE residency. So that way I don't feel I'm that old. First thing. Second point I want to mention, like the my nature is very curious, and like I love to learn things on each passing day. So uh, that nature of learning newer aspects, and that searching newer things, and also like contributing to the program by your positive skills, by your positive experience, actually making me a reliable and dependable candidate for your program. So that way I don't believe I'll be a difficult learner and a difficult trainer also. In fact, I'll be a good fit for your program, I feel.
Okay, that was a really good answer. Now, one final question I would like to ask is, tell me about your weaknesses, the most common question.
First thing I want to say, like, my everyone who is near to me, they call me as Mr. Perfect, Miss Perfect, because of there is one nature. I always do a lot of overwork. I take lot of stress to do everything, like giving my 100%, like up to the perfect, so that nothing will be left. So that way I always try to do, like I put lot of effort whatever I do. So that aspect sometimes like makes me anxious and restlessness. So I'm working constantly, and just to overcome this thing. And also, like, nowadays I'm doing meditations, reading self-help books, and also using my creativity skill as a healer, just to make my time more productive and do everything in a better way. So that is one weakness I want to talk, because during my residency I had lost almost 5 to 10 kilo just to stand up to that level uh, of my own expectations actually. So yeah, this is one of my weakness, I would say.
Okay, thank you. Now, if anyone else would like to ask few questions.
So, Dr. Sapta,
Yeah, good.
Yeah. So I would like to ask you, how do you see the delivery of healthcare evolving in the 21st century?
Yeah, definitely. Um, yeah, it's actually it's a question we all should think about. First thing, I feel like it is going to be more technology oriented. Like there is a huge collaboration with high technologies like healthcare is being healthcare is being used with high technologies like artificial intelligence, highly improved EMR systems, and the using technologies for for making the for bypassing the manpower like nano robots and all. So the technology is going to play a great role in 21st century for sure. Another thing I want to talk about the newer types of diseases we are going to meet. Also, we have started meeting because I am from pediatrics, so I want to talk about this that this mental health and this mental diseases are no more prevalent in only in elderly people. It is going to be it is nowadays affecting the pediatric population also, and also because of lot of social media use and everything, we are seeing a lot of fascinating syndromes like internet syndrome, addiction, peer pressure syndrome, television syndrome, which are already there in our textbook. So that way, as pediatricians, we these are actually real challenges because there is no sure shot treatment fever or cold. We have to treat holistically, like being part of their family. It will take like years of time. So the counseling part is going to play a great role for such lifestyle diseases. And another thing, I will like to talk about the role of biotechnology and gene therapy, because nowadays lot of newer researches are going on this aspect of and gene therapy is playing a great role in healing the healing the healthcare system. So yeah, I could see more involvement of biotechnology and pharma world in the upcoming healthcare system for sure. So these are three things I would like to say on first place. And
Yeah.
also, like on fourth point, I will talk about the involvement of social medias, like for treatment, for management, for creating awareness. We can like nowadays the healthcare professionals are reaching to a larger group of people just by using the social platforms. This was not there 5 years back. So yeah, so role of health social platforms in healthcare system is also increasing.
Yeah, you made a good point in that. Okay. So the next question I want to ask you, how well do you see yourself adapting for the American health system?
Okay, I feel like I'm a very quick, adaptable person, and I easily connected to any kind of newer system. This is something my personality. So definitely, it there will be some challenges because I have been a hostelite for maximum time from class 6. I'm like I'm traveling from place to place for my academics and for my career. So shifting to United States is not going to be a great challenge for me. And of course, I have my supportive partner who is working there. So that way, the journey is going to be more comfortable for me, I guess. And there will be a few challenges like adopting to the newer version of the EMR system, and like maybe some part of the counseling, and maybe learning some newer languages like Spanish and other languages. But as I'm a quick learner and a quick adapter, I think like I'll adapt to the situation very quickly.
Yeah, yeah, you know the point. Well, you can also say in that way, okay, because in the American health system, I think everything is being digitalized and it will be reviewed. Like ACGME, they have certain rules. Okay, I think they have rules for the residents also. So
Yeah.
everything is watched also. Okay, that's why I think it's very easy to work there and also get adapted. Okay,
I mean,
I
it's
have that.
going to be easy, in fact.
Yeah,
Just
yeah,
the initial point will be a little bit difficult, but once I will learn, then I think it is going to be easy.
yeah, definitely.
I think you have a good point for everything, but just to make it shorter. And you are a very likable person. I'm sure they would really like you. Your smile and the way
Okay. I
your
think
voice is
go
very,
with
very
this
captivating.
point because sometimes I feel it may backfire me also. So I don't know how to
Yeah.
like respond. I need to work.
Yeah, the voice alone, it's like a soothing voice, and anybody will want to listen to you. But I think you should make it shorter. You get what I'm saying?
Yeah.
Yeah, but it's interesting so far. Yeah, I want to ask a question. Tell me about
Okay.
the greatest mistake you have ever made.
Okay. Greatest. Okay. So mm I will answer this question like this that yeah, the incident was, I believe that was not a greatest mistake because the patient care, I mean, fortunately, the patient care hasn't hampered by that mistake. But yeah, I take it as a mistake. So that's why I want to discuss here like when I was in my internship, which is called as clerkship in US. So when I was doing my clerkship, so my responsibility was to like collect, draw blood, collect the reports, and making everything ready before the morning round of the attending. So during that time. I just collected the all the reports, and I saw someone's calcium was like 6.2, so which is very low. So then I just talked with my attending, and he also like because it could be a like serious condition. He just went with me to the bedside and examined the patient and all. But the like he suspected something because the clinical condition was not correlating with the investigations. So and he just suspected something, and he just told me to recheck the values. But when I rechecked, I just felt very embarrassed because I just printed the wrong report because there was two names with two similar names with different surnames. So that way I just accepted my mistake and discussed, and my attending was so considerate. He considered the everything, and also like he talked such kind some funnier incidents from his training period. So from that incident, even I have learned that from that time onwards, every time I would make sure to check everything from MID number to the patient name, it's like age, everything, every details before doing anything or before discussing any single point, especially in the hospital or in the medical medical discussions. So that was something I took as a clinical mistake,
Oh,
but I'm not sure it's the greatest mistake or because I have like corrected the mistake before any kind of patient care for sure.
okay, yeah, that makes sense. Then the last question is, do you intend going back to your home country after residency?
Sorry, can you please repeat?
Do you intend going back to your home country after residency?
Uh, Definitely not, because as I have said, um, it was my childhood dream to come to USA from the class 6. So definitely, I'm not thinking to go back after my residency. In fact, I'm seeing myself to be a established pediatrician in next 10 years in the United States and to be one of the global leader. And another very personal point is my fiance is working in United States, and so we are seeing like our future and our next generation to get all the next step opportunities in United States. So that's why like coming back to my home country, I think it's not an option for me at all.
Yeah, that's a very good response. I really like all the responses. Good job to you. I know you'd do very well in your interview. Yeah, you will, as if you're totally ready for any questions that come up. Yeah, that's a
Thank
good
you
one.
so much.
Yeah,
Yeah,
you're welcome.
go ahead if anyone wants to ask any question.
Yeah.
anyone is asking any question? Am I?
Yes, you are. You are audible.
Okay. So, is there any question to answer? Actually, I'm not listening anything. So,
Hi, Dr. Sapta.
hi.
So I would like to ask you, can you tell me some difference about your healthcare system in your country and the US healthcare system?
Yeah, thank you for your question. I must say it's a very valid point to discuss. Um, like from my experience, definitely I believe the medicine and the patient care is 80 to 90% is similar in United States and India. However, there are some some differences that I have observed, like the prevalence of cases because of the geographical preference and locations. For example, even if we have read everything in our theoretical book, the country like India, from where I belong to, there we are seeing more communicable diseases, more infectious conditions, and more like the old age diseases like cerebrovascular strokes and hypertensions and all. But when I was doing my clinical rotation, what I have observed, USA, the even if it's communicable, but the condition is little bit different. Instead of malaria, instead of dengue, we are seeing more Lyme diseases, and also like this lifestyle diseases like diabetes and like cardiac conditions. And also there are a lot of pediatric syndromes which I have heard and which I have only read in the books. So like that way the prevalence of the conditions is little bit different, uh, like keeping everything intact. Like overall medicine is same, but there is little bit difference in both the system. And another point I want to talk about, the places where I have worked. In fact, in maximum government setups, the like the doctors most of the time work under high workload in India because of the very high patient load and low number of doctors, because it's an overpopulated country. So the workload and the patient load in country like India is sometimes more. However, I see in USA the people overcoming that time by giving more quality to the patient care. So that way, sometimes the quality of the patient care can be affected because of high patient load in developing countries. Another point I want to talk, the data. The data departments are different. Like in USA, we have very advanced EMR system, but where I was working, that was a government system. We had a different data collection system that is called MRD, medical record system. Even if all the medical data and everything were well preserved for years because it's very important, but I'm looking the USA EMR system is a more advanced version and more digitalized version. So these are few things I feel personally is a difference in both the system. And the opportunities about the opportunities of growth in research in USA is like highly it's very eye catchy. So this is also something which I feel is one of my interests to come to USA. So these are four things I want to talk about.
I think that's a really good answer, Dr. Sapta. Yeah. And coming to the workload, I don't know if it's good to mention the workload because it might give an impression that you're not ready to take the work. I mean, if it's, the workload is high, maybe it gives an impression to the PD that.
We can talk about the patient load there, because like giving this is an overpopulated country, sometimes the patient load is high. So you can talk that also, like that makes me like, as we have worked under like critical and like high pressure conditions, so that has made me more efficient. So that's why I'm like confident to work in any kind of critical and adverse situation. So that way we can, I think, frame.
Yeah, you're right. Yeah. Anyone else who have feedback for Dr. Sapta? Okay, Dr. Sapta, can you answer why should I choose you among other applicants? Or did someone else ask this question?
Yeah, it's actually a very difficult question because I believe it is actually a very tough task to choose one residence among 200. And but you know, I believe everyone is doing their part and everyone is putting their best effort for the residency. But however, I feel like I will be one of the best match for your program. Especially, I'm going to talk first thing that this 6 year of pediatric working and clinical experience in my home country, as well as approximately 6 months of clinical rotation of United States is actually making me more reliable and dependable candidate for your program to adopt to the situation and system uh, in a better way and in a very quick span of time. And apart from that, I want to talk about my skill. Like, I'm very much inclined for leadership, public speaking, and creativity, writing, and creativity skill. I have played multiple roles during my med school and residency. So these are few things I'm going to definitely use and contribute to your program to enhance, to bring the best things as a good team player for your program. And third thing, I want to talk in a lighter note, as I'm a creative person, uh, and residency can be stressful and hectic some of the times. I would like to, in fact, I'd love to entertain my teammates through just reciting poems, music, dance, because I'm a trained dancer, and also just by inviting my friends for some good dinner because I'm good at cooking. So that way, these are some things by which I can bring some lively environment to your program. So that's why I feel I'll be one of the good fit for your program, and you should choose me.
Okay. So you have said you have experience in play. I mean, you have experience working with a team. Can you tell me a moment where you
Okay.
have worked with a team and also your leadership qualities? Can you mention a moment where you have been a leader and guiding a team?
Yeah. Definitely, I was actually expecting these questions, and I'm very much interested to answer. I will talk about COVID period because I don't feel anything is more distressing than the COVID period that we have faced as a healthcare professionals. And during that time, I was PGY 3 residents working in Delhi, and Delhi was like covered in all front medias for facing unbearable challenges. Like every setup was struggling for like shortage of healthcare professionals, human resources, medical resources, even if the oxygen cylinders, patient beds. So during that time, actually, I was leading the COVID healthcare task force, especially for pediatric. And I will say a lot of many of my colleagues and junior seniors got actually sick. Some of them got critically sick during the treatment, so they had to take sick leaves. Fortunately, I was one of the colleagues who was negative till the end. So I had to lead the team for a longer period. During that time, I had taken the responsibility. Me and my team had done a lot of trials because we have to make a strict trials, whom to admit, whom to shift, whom to refer, that way, because it was a very critical condition, a new condition for all of us. Even I have remembered some time where I have shifted the critical babies to the nearest referral system who are needing like ICU setup. I have intubated many babies on the way, so that way also I have saved few of the newborns and few of the babies. That time also, beyond my leadership skill, I have used my creativity skill, like addressing the issue through by attending webinars, being panel members, and also later during the later period, I have participated in lot of webinars for vaccine hesitancy, which was a great challenge for a country like India during that time. So that was an incident definitely I want to talk, because I have used my leadership quality and creativity quality both for saving many lives along with my team directly and indirectly. And I feel I have justified my position and profession in a very good way by working in the COVID emergency force.
Okay, I think this is good answer. I don't have any other comments on this answer. Can anyone else give feedback?
Yeah, please go ahead and give your honest feedback, because I want to modify also.
So hi, Dr. Sapta, it's me again. So I really liked
Yeah.
all of your answers. You have like you were like, the one thing I really liked about you, all your answers were, you were so explicit, like you gave examples and details to everything. So like we can really relate to it, the way you were saying things. But one thing I would
I
like
think
to say,
that's the good part of being a old graduate. Sometimes I think, otherwise everything is negative about being a old grad, but your experience is something which is positive.
yeah, no, I don't think so, because I'm also like, I have done my residency in my home country, so I think we are in the same situation. But
Okay. Yeah.
but one thing I would like to say is that I felt so that your answers were could be a little more concise. And
Yeah.
because as I have heard and seen in few videos, that we have a very time limit to every each hour questions, like even if you, it's like, tell me about yourself, it should be maximum like 1 to 1.5 minutes. So what I felt is, though all of your details were very relevant, but um, it would be better if it would be a little more concise. And one other thing, what I felt was, few of your answers, I felt like it was not very specific. Maybe because of which it was not concise as well. So maybe you
Okay.
can work in these two things.
Okay. Okay. Yeah, sure. I'll
Okay.
try to, because I think that is also one of my weak point. Like, I don't know where to stop sometimes. So,
It's all
yeah,
right. Maybe you can put on a timer and then practice.
yeah,
It will help.
yeah. Yes, yes, definitely.
Okay.
Okay.
Thank you.
Okay, thank you.
Yeah, Sapta, yes, because you have a lot of to say actually, and you have a lot of valid points. That's why you every time you remember another point and you want to add it. But yeah, your answer is very valuable. But as she said, yeah, you have to just put a timer. So, and
Yeah.
actually, I think it benefit you because if you short the question, they will ask you more, and actually, you have very good answer for everything. So this is
Okay.
also better for you. Yeah, that you will be a
Okay.
good.
Yeah. Makes sense actually. Anyone is asking any other question? Like very silly questions. How you people are like managing with the glare? If someone is specially, wearing the glass, how to manage that? I don't even know. Even if I'm not like putting the ring lights, then also it's there.
I don't know. I'm wearing the glasses and yeah, don't have an
Is
answer. Anyone has a solution?
Yeah, this is the issue. I mean, it's only you have to be very specific with the positions. If you are like moving little bit, then it's coming. So
Yeah, but I don't think someone will judge you for this one.